not only because I'm the mayor of the city of Youngstown and have the governor here, but also it's an opportunity for me to publicly display how well oiled and operated we have right here in the city of Youngstown. Our health departments, they've been working tirelessly for the last year. Any of the issues that come up, we find the problem, we solve it, and today is a great testament to see that where we are, where we've come in the last year, is really critical for us. For me personally, I had my first shot, and I wanted to make sure it was public, and it's just the icing on the cake to have the governor stop by our site while I got my shot today. I just want everyone that's out there to know that it's safe, it's effective, and it's one of the ways that we can get back to normal in our life, and that's why we're here today to celebrate the opportunity that we have in this community. So with that, I'll let the governor lead off or come after. I'm going to put my mask on, Governor, before you come up, and there we go.
Well, good morning, everyone. Fran and I are delighted to be here in Youngstown. And first of all, I just want to congratulate the mayor, congratulate the health department, really doing a great job. There's another 34 separate locations. We will pass 2.8 million Ohioans who will receive their first shot. 2.8 million Ohioans. We're right at about of the population of the state that has now received a vaccine. So we're moving forward. 2/3 of those in Ohio over the age of 65 have now received. Obviously, those are the individuals who are the most vulnerable. So we're glad it's at 2/3. We just want to keep encouraging people who have not, had an opportunity to get their vaccine, who have not taken that opportunity, to use this now as an opportunity to do it. I authorized all of the health departments in the state or any other of the locations. We have about 1,300 locations around the state of Ohio. So we have now authorized them, if they cannot fill slots this week or next week, we've authorized them this morning to go ahead and anybody 16 years of age and older. So anybody 16 years of age and older, if that department has not been able to fill the slots this week, they can go ahead and take anybody 16 years of age and older. I want to ask Health Commissioner to come up. Aaron, why don't you come up a moment, and I'll transfer this to you. I'll set that down there. Okay. I'll stand back, and you can kind of give them a report of what you're seeing, and maybe kind of what the challenges are in the next few weeks, what the goals are in the next few weeks. Health Commissioner and I are on the phone every week, once a week. Early 7:15 Monday morning, and we have a very, very good discussion. The mayor and I are on the phone usually twice a week. For a while it was every day, literally, but usually we're averaging mayor twice a week, and this is the way that we keep in touch with what really is going on, and frankly, how we find out what the needs are of the community. This has really been an amazing grassroots effort. People in the Mahoning Valley, the health departments of the Mahoning Valley have really, I think, done a phenomenal job. And if you look at the health workers over there, they've been through a long year and they're still going and headed down to the end of this. So, Aaron?
So good morning, everyone. Again, thank you so much, Governor and Mrs. DeWine, for being here today. We're so excited that you came we call this our home. This has been our home since the very first of the year, and we're looking to transition out of Eugenia Atkins Center so to go to different places in our community. So this week, we will be here tomorrow, and then on Wednesday, we're heading to New Bethel Baptist Church on the south side of Youngstown. And then on Thursday, we'll be at McGuffey Center on the east side of Youngstown. This past Saturday, we were at St. Christine Church on the west side of Youngstown. So you'll start seeing us in the different sides of town so that we can go where the people are. Because we've been so lucky right now, we've given almost over 12,000 vaccines just here in the city of Youngstown. And we know there's still more people that are out there that maybe haven't, wanted to get their shot yet. We're kind of waiting to see if people were going to go ahead and get the shot. And now, there's still people that are home that just may, haven't been able to get out there. And so we want to come to you and to see if that would, get those hard to reach people, because there's still people that need to be vaccinated in our community. So we have, if you go on our website, covid19.youngstownohio.gov, we have open our, for this week, we're pretty much booked, but next week you can see we have openings on Tuesday at the Spanish Evangelical Church on the east side. On Wednesday, we are at, where are we at Wednesday? Oh, south side.
Too many places.
Too many places, right? And then Thursday, we are at the Cavelli Center. Oh, I know now. Wednesday, we are at Metro Assembly Church, which is on South Avenue. And on Thursday, April the 1st, we'll be at Cavelli Center. We also have openings for Cavelli Center on April the 8th. So there are plenty of appointments that are available. Please take the time to go out. If you don't have, we have a number that you can call, and we'll walk you through the process. So it's 8 to 4. You could call that number, and then they will walk you through. If you don't have a computer, we'll do it for you. So we just try to make sure that everybody that needs vaccinated, that wants vaccinated, will get vaccinated. So again, pass it along to your friends and family, your loved ones. This is the time now. I love where I've been hearing on the news, like, this is our shot. This is our shot to be done with this, to move on. Keep wearing your masks. We're very blessed to live in the state of Ohio, this wonderful state, this great city of Youngstown that has been really trying to combat this from day one. It's hard to believe it's already been a year. And as you all know, on Friday, we're going to have a memorial here for the COVID-19, the members of our community that we've lost and the people that have suffered with COVID-19. So again, thank you all for being here today, and I'll turn it back over to the mayor. Thank you.
Governor, any more questions?
Let me just add one additional thing. We are really in a race at this point. We are seeing in different parts of the country a movement up in the number of cases. We're seeing a significant movement in Michigan, for example, West Virginia. In Ohio, in the last few days, we are seeing what appears to be a plateauing out. These cases were going down. It would appear that we're now starting to plateau. And of course, our concern is that we start back up. So this is a real race, and we have to stay on the defense. We have to continue to wear our mask. We got to do that. And we've got to just vaccinate as quickly and as fast as we can, as many Ohioans as are willing to take this vaccine or these different vaccines. So it is really a race. We know that the more Ohioans we get vaccinated, it makes it much more difficult for this virus to move forward. One day last week, we hit over 80,000 Ohioans who had received just in one day their first dose. So the more Ohioans who get the vaccine, the more we'll drive this virus down, and the quicker we'll be able to get back to normal. And we'll be able to take the mask off. We'll be able to do the things that we always want to do. For Fran and I, we got our second dose about 3 weeks ago. So we have the immunity at this point. And what's that has enabled us to do is, frankly, spend more time with our grandchildren, more time with our children. We've been able to, in the past, if we were outside and wearing a mask, we were able to see them. But now we can, hug our two grandchildren that were born in November. We have two grandbabies born in November, and it's a good thing. So this is our ticket out. This is our ticket out of this mess we've been in for a year. The other ticket is the shots. So the shot and the mask, we're going to get out of this, and we look forward to moving forward. So any questions for the mayor or health commissioner or for me?
Governor, how important is it to have sites like this in communities so people can have the access, quick access to?
Yeah, you know, what's going on in the valley, I think, is very good. It's local. It's delivering these vaccines in places that are in the community. We had a choice at the beginning. We could have done what some other states did, which is to go to mass vaccination sites, and everybody would have to drive to that site. We decided not to do that. We started with 700 sites. We are now over 1,300 sites. We are now beginning to layer over on top of that, in addition to that, and they've done a very, very fine job here, but we're not done yet. We now have opened it up. Anybody 16 and over can get it. College students, whoever, even high school students at this point, those 16 and older will be able to. Everybody, the quicker you get it, the quicker we're going to get it. Getting that herd immunity that we've been talking about, which means that this virus then is really driven to the ground, are the quick tests, these 15-minute tests. So they are out there. We invested the money. We have a lot of these out there. So if there are uses in the community here in the Mahoning Valley, for example, for these, I don't know whether, Aaron, you're using any of these now, but they're available. They're available to schools. They're available to colleges. We want to get them out. They don't do any good sitting on a shelf. We want them to be used. So this is really an opportunity to do that. If you look at the total number, and I look at it every day, the total number of tests that are being done, most days they're still pretty high. And the good news is that the positivity rate is hovering around 3%. We wish it was 2, we wish it was 1, we wish it was 0. But at one point in December, we were over 15%. So the positivity numbers are good. We just can't let our guard down. We're, to use a football analogy, we're driving, we're in the other team's territory, we're down to the 4-yard line, but now's not the time to walk off the field, spike the ball, and say, hey, we're going to go away. we got to finish it. We got to drive through that line and finish this job.
Governor, early in the vaccination cycle, there was an emphasis put on minority communities. Have you seen statewide more of a push and
Yeah.
a successful push?
Yeah, we've had a push all the way through. We have been more successful recently. I'm looking at those numbers that are reported every day, and that ratio between the white number and the African American number is getting better. But we have a long ways to go, and so I'm going to let Aaron discuss kind of what they're doing here, because I know that I've talked to the mayor a lot. Or Mayor, either one of you can jump in here and tell us what's going on. I'll get that back to you. There you go.
Just real quick, I want to emphasize, and Aaron as well, that's been one of our issues that we've been focused on to make sure the most vulnerable. You remember when COVID-19 hit that we found out the disparities in health were in the minority community, and now it's even more prevalent. We want to make sure that those who want it are able to get it. That's why Aaron and her team, they've been out in the community. They've been taking it to congregate settings. And I appreciate the governor for allowing me to be on the minority health task force. And we talked about those issues of how do we get to the people that need it the most? And that's what we've been doing here. So we've continued to make sure that message was clear. That's why an African-American mayor took his shot publicly today to ensure them that I'm taking it and it's for the people that I represent. But minorities are more hesitant, and we want to remove those myths. We want to make sure they're armed with the facts. So that's one of the reasons we did that today publicly as well.
And I just wanted to add, I think this is very important. So from the very beginning, we have been working, the mayor directed us to work with our local community leaders and local pastors. And so we would meet every Thursday and we'd pray and we needed it. I needed it. It was stressful. And so we would do prayer. And then at that time, we started to develop relationships. And so when it came time for them to maybe close their churches, close their services, they were able to talk to me, listen to me, and we worked that out together. Well, when it comes time now for when it came time for testing, they were willing to open their churches up, open their parking lots, welcomed us to their churches to be there in the city. And now we're at vaccine times. And so now they're, again, opening up their churches for us to do the clinics. But also, I worked with local pastors who worked with their congregations, worked with people in their neighborhoods that felt safe with them, that trusted them. So then they were able to give me lists of people that needed to get in. We're also so lucky to have our medical director, Dr. David Davis, who is here today, who worked with his patients and with people in his community, with his fraternity, with different sororities to get people. We had 2 sororities do calls for us and called people to come bring them in. So I think we did a great job when it comes to working in different minority populations. We also worked with YSU, their diversity department, and getting in people. I know that they talked to me the other day about people that are deaf and how we can work with them, or people that are Vietnamese that are working, in the area. That what can we do? We've had several Chinese people come through here, and just unfortunately, we try to do like the talk to text with the thing, but it's so nice to have an interpreter. So today we have several Spanish speaking people here, and we do have an interpreter here so that they feel welcomed and can easily talk to them. So I think that we've done a great job. And as of last week, we were at 33% in our minority population, which I think is great. And so we know it's not the best. We want it to be better. And so we'll continue to do that until, we're happy with where we're at.
Great. Anybody else? Okay. Thanks, everybody. Thanks, Mayor.
Yeah, thank you guys for coming out. I want to make sure everybody remembers this Friday, the 26th, at Wing Park Community Alley. We will be doing a memorial for all those that we lost, the families. We're asking the families to come out, bring a picture of your family, and also those who suffer from COVID-19, the long haulers. We just want to take a moment this Friday at 6:30, just to take a moment to remember them and let them know we still support them. We want to make sure that we remember their family members that's lost during COVID-19. So thank you guys for coming out.
Thanks, Mayor.
Yeah, absolutely.